As I'm sure many of you are aware, our community has consistently, strongly encouraged our congregants, our community's members and friends to get vaccinated and boosted against COVID-19. We are now adjusting that position and will be expecting all eligible congregants to be fully vaccinated, including booster shots, for in-person participation in any UUA activities happening on our premises, any Sunday services, and any spiritual growth and development programming. The exact language of this new policy can be found on our website, www.uuaa.org. If you're not choosing to be vaccinated or boosted for any reason at all, we ask that for the time being that you please participate in our community's life through our live streaming and on-demand options. We thank you in advance for your understanding of this request and your cooperation with it as we seek to support the health and safety of our collective community. We note that this policy does not apply to children under 5 years of age who are currently ineligible to be vaccinated, individuals such as children and youth aged 5 to 11 who are not yet eligible for booster shots, and other individuals who may have medical needs that preclude the possibility of vaccination or getting a booster. As a community grounded in the spirit of covenant, grounded in the promises that we regularly make to one another in community, we'll be approaching this new health and safety expectation as a covenantal understanding. Our community's new health and safety expectations will be widely shared as they are being done this morning. Individuals discovered to be knowingly violating this new policy will be referred to the Living Our Values team, the team that handles questions of covenant and relationship in our community, and if need be, the Healthy Congregation Response Team, which is a level up from that. As a practical matter, it's worth noting that unlike larger organizations, UUAA, our community, does not have the financial or staff resources to check or verify the validity of vaccination cards, to create a vaccination database, or undertake any similar measures. Therefore, we'll be relying on a covenantal approach to vaccination and booster status for practical reasons, as well as in fidelity with the spirit of Unitarian Universalism, which is a covenant-based tradition. When our COVID advisory team met recently, we also formally adopted a maximum capacity number for in-person events in our sanctuary. We've been operating with this as an informal maximum since September, but we've now formalized this, that any event taking place in the sanctuary, we have a maximum capacity of 50% of our pre-pandemic maximum capacity. Now, if you've been attending, and I see some of you looking around, if you've been attending any of our in-person services since September, you know that we haven't been anywhere near that 50% of our pre-pandemic maximum capacity. In fact, on typical Sundays, it is far below the 25% of our pre-pandemic maximum capacity, including today. All other health and safety protocols that UUAA has previously announced all remain in place. This includes universal masking for everyone who is on our premises while they are on site. All chancel and music leaders appearing unmasked must have a negative COVID antigen test less than 24 hours before appearing unmasked. And this also includes our ensemble singers who sing masked. They also have to have a negative COVID antigen test less than 24 hours before singing. We retain the possibility of physical distancing, of social distancing in the sanctuary. And finally, we continue to utilize the significant upgrades that we invested in our HVAC technology, our air conditioning and air circulation system, that includes significant technological upgrades, technology that kills viruses and bacteria, and allows for a complete turnover of the air in this room, in the sanctuary, which is a rather large space. The air is completely turned over every 15 minutes and treated with that bacteria and virus killing technology. Remind all of us, of course, that any in-person activity right now entails risk to one's personal health and well-being. Given that, only you and your loved ones, your family, can decide individually and collectively what level of health risk is appropriate for you and or your family. We encourage you to engage in that reflection and conversation, first and foremost, most importantly with yourself, and then also with your loved ones, to arrive at the behavior, at the approach that feels right for you. And know that we support you in that, whatever you decide. It's the reason we're engaging in multimodalities. It's to create options for our community members to honor their health needs. Finally, please know that as the Omicron variant's impact on our local community still unfolds, we are actively following daily developments and assessing the need for further adjustments. To that end, I would invite all community members to please check on a weekly basis our electronic announcements around what our upcoming schedule is going to be and what the formats or modalities for events are going to be. If circumstances warrant it and we need to pivot and make such changes, we may shift from 2 services on a Sunday to 1 service, or from 1 or 2 services to virtual services only for some duration of time. We may shift timings in order to accommodate what those scenarios might look like. So please check your electronic communications to stay up to date on what our timings for events are going to be and what the modalities will be. We thank you for doing your part in helping ensure that all of us are doing the very best we can to take care of one another in community. Please know that it matters and it makes a positive difference.